part of my job was to find out how to bridge distances, and getting into technology was the next step rather than sending people either to the doctor or the doctor to the people. Technology is advancing at such a rapid rate that healthcare organizations are having a difficult time keeping up with it. And healthcare organizations are going through a rapid challenge themselves, going from a volume-based model of care to a value-based model of care. So it's very important that someone work as a bridge in between these two and help them work with one another, and that's what I do. I think just knowing where to start. Obviously, they're starting where they're feeling the most pain, and that is where penalties come in from the federal government or payers in terms of hospital readmissions and others. And the technology companies are having challenges figuring out how to help the hospitals and health systems help themselves, knowing where to prioritize. Right, there's a lot of things going direct to consumers right now, like Fitbits and wearables, and a lot of the healthcare systems are looking at more of a chronic disease state. So you have two ends of the spectrum. You have somebody that's on a wellness perspective that wants to use these tools to stay well, and whereas others are looking at how do you manage people with chronic diseases. So, which needs to go and be part of the traditional healthcare model, whereas direct-to-consumer things are more of a value-based or value-added service to a person's life. I think as people develop and technology advances to where there's more direct-to-consumer items that are useful and serving as healthcare tools, that health systems and providers will be adopting those. And I think as other technologies advance that hospitals are using to manage people with chronic diseases, that the technology companies will adopt those and make them more efficient. Actually, I think it goes down to motivation. And when you're a person with chronic diseases, your motivation is living independently or being symptom-free or managing your symptoms. So the tool is more of a means to an end for your chronic condition, and how that your motivation is being driven by your need to, or desire to stay independent in age and place. Whereas a person that might be, a younger person might be using the same tools for a very different purpose. In the end, the technologies are going to have to combine so the data can be shared. Data that's collected in a Fitbit, if it can contribute to somebody's management of a chronic condition, then that data needs to be incorporated in that, because that all goes into parts of the decisions that are being made on people's healthcare. Whereas somebody that wears a Fitbit and then abandons it because they already know what it's going to tell them, don't have the same motivation. They're on a different goal, which is to stay well, whereas opposed to somebody that has a chronic disease, their desire may be to stay living independently. In the past, the challenges people came to me with are typically providers that were maybe rurally located or somehow distance-wise removed from other specialists. So there's a need to get information rather than patients from one community to another. The challenge now is looking at how do you meet the needs of your community even better. And with the IRS requirement for nonprofits to do a community health needs assessment, a lot of that goes into managing the health of your population. And I'm finding the challenge now is how to do that most efficiently, and where can technology play a role in that. I think the time is right now for organizations of all sizes and all locations around the country to really look at how do we more effectively meet the needs of our community, whether it's chronic disease or wellness programs, and where's technology find a role in that? I can help them answer those questions and help them come up with a plan for how they can best address those needs.